Welcome to the 2021 4-H Camp COVID Procedures Training. Thank you so much for volunteering your time and service to the 4-H camping program. We know this year is going to be very different, but we're excited to have any opportunity to camp and hope that together we can make this summer's camping experience just as magical as always. Kentucky 4-H camps operate under the guidance of the University of Kentucky, specifically the College of Agriculture, Food, and Environment. As many of you are aware, all 4-H summer camping was suspended for the summer of 2020. This summer, we will be resuming residential summer camp following strict safety protocols. This plan was developed using best practices and guidance from the CDC, American Camping Association, the Kentucky Healthy at Work, University of Kentucky, and Cooperative Extension Service guidelines. If you would like to see the full 4-H Summer Camp COVID-19 Mitigation and Operations Plan, you can view that with the link here, or you can go to our website, lincoln4h.org, and download a copy there. We're taking additional steps this summer to protect our campers, volunteers, extension staff, and our camp staff. The operations plan is designed to address COVID-19 and includes virus prevention methods, cabin-centric programming, and increased cleaning and sanitizing procedures. All camp staff will complete an on-site COVID-19 prevention training in their areas of focus. On the first day of each camp session, extension staff, volunteers, and campers will participate in a safety orientation led by camp administration and program staff that includes COVID-19 prevention training. Signage will be posted throughout the camp, promoting hygiene and COVID-19 prevention methods. Daily updates pertaining to camp safety protocols will be provided to extension agents and volunteers at our lunchtime meetings. Studies have confirmed that when a summer camp implements multiple COVID-19 prevention methods, referred to as non-pharmaceutical interventions, the risk of potential virus transmission decreases dramatically. So this summer, we're going to be implementing some pre-camp health screenings and daily self-screenings. Cohorting, meaning we'll be in the same groups throughout the week. Masking, increased cleaning and disinfecting, good hand hygiene, ventilation and air filtration, reduced camp capacity, and physical distancing. Prior to arrival and check-in of 4-H camp, all campers, volunteers, and staff will be required to complete a 14-day pre-camp health screening form. These are from the American Camp Association. There are two versions of this form. Version A is for minors and version B is for adult volunteers and extension staff. This form will require participants and camper parents to check temperatures each of the 14 days leading up to arrival day of 4-H camp. You'll also need to self-screen for symptoms and to answer 5 health-related questions. This form is a tool to help remind camp participants to be aware of their health and contact with others leading up to camp. Individuals are encouraged to limit contact with others outside of their household during the 14 days prior to their camp session. If a participant comes to camp or the bus stop with any symptoms of COVID-19, they will not be permitted to remain or go to camp. All participants will be required to complete their 14th temperature check on check-in day. If your temperature is over 100.4 or higher, we'll allow a 15-minute wait before a second temperature check is administered. If the second temperature check is not below 100.4, this individual will not be permitted to attend camp. If a participant fails to fully complete the 14-day pre-camp health screen, they may not attend camp. Here's an example of the pre-camp health screening form, and everyone attending camp will be sent a packet that includes this information well before the 14 days must start. Please bring these forms to the bus stop on Tuesday morning. You won't be permitted to load the buses without this form completed. This is the back of the 14-day pre-camp health screen that just has some information that will be helpful for your camper to keep them safe before, during, and after 4-H camp. On opening day and check-in of camp, we'll have a drop-off schedule in which campers arrive to the bus stop during staggered time frames. Our goal here is to reduce density and physical interaction of individuals at any given time in the check-in area. We want to maintain physical distance with other parents and guardians and campers. You will need to wear a mask when exiting the vehicle, even though we are outside. And the best practice is for parents to remain in the vehicle during the camper check-in process. If this is not possible, then we'll suggest that only one parent or guardian assist the camper through the check-in process. As campers arrive, we'll need to do an initial health screening of campers outside before their parent or guardian departs. We'll also need to document their temperature on day 14 of the pre-camp health screening form. We'll have hand sanitizers set up upon entry to the check-in area, and we'll have some signage of physical distancing, cough etiquette, hand washing, and stop the spread of germs. For our luggage, we'll need a couple volunteers to wear a mask and gloves during this process to help load luggage. We'll have campers wipe down their handles and other non-porous portions of their suitcases as they bring them up to the loading area. Our buses will be at 50% capacity or less, so we'll be seating campers one per row and skipping every other row in a zigzag pattern. While on the buses, all passengers and the driver must wear a mask. We'll also need a volunteer or team leader to have everyone use hand sanitizer before entering the bus and as they exit the bus when we arrive at camp. These are some daily reminders that you'll need to keep track of for yourself and your campers. Masking. All guests are encouraged to bring a minimum of one mask per day to camp. Clean, spare masks must be kept in a sealed and labeled plastic bag. Remind your campers that masks must be worn indoors at all times unless sleeping, eating, showering, and outside when 6 feet distanced from others cannot be guaranteed. It's okay to remove masks when walking from activity to activity, but individuals must be distanced. When indoors, guests may remove their mask if they're sitting or laying in their own bunk, while seated for meals, and while inside the shower stall. Remind your campers to wash and sanitize their hands before and after eating, when entering and exiting buildings, and before and after using the restroom. Cabin leaders will be supplied with sanitizing supplies to disinfect doorknobs, light switches, bed rails, and cabin floors twice daily. Please use the supplied gloves when completing these duties. Campers, volunteers, and extension staff will need to self-screen daily and report any COVID-like symptoms to the camp healthcare provider. Remind your campers that if they don't feel well, it's important to let you know. Any individual with COVID-like symptoms will be isolated immediately in the health office and may not remain at camp. Parent or guardian must make arrangements to pick up their minor at the earliest opportunity. Cohorting. We're limiting our activity groups to no more than 2 or 3 cabins per team. Teams will travel together to and from activities with no close interaction with other teams. Physical distance and mask mandates will be in place. And our camping group has mixed up the cabins so that you'll be cohorting with others from different counties. Camp capacity has been decreased to 50% to allow for appropriate physical distancing in cabins, at meals, and at activity areas. Remind your campers to maintain 6 feet distance between them and others at all times. The doors and windows of some camp facilities will remain open at all times to increase ambient airflow and ventilation. Remind your campers to leave windows and doors open in these areas. All cabins and dining facilities will have MERV 13 air filters, ionizers, or UV filters in the air conditioning units to ensure appropriate air filtration and comfort. Let's go over the daily cabin cleaning procedures. Camp volunteers will be provided cabin cleaning supplies upon arrival. This includes non-aerosol cleaner, paper towels, brooms and a dustpan, a Swiffer wet jet or wet mop, and gloves. High-touch areas in the cabin must be cleaned and disinfected twice daily by volunteers. Be sure not to spray cleaner or disinfectant on or near any person. Wearing the provided gloves, complete the following twice daily. Spray cleaner on doorknobs, let sit for 30 seconds, then wipe off excess liquid if needed, or use the supplied wipes. Spray disinfectant on light switches, and repeat the same process. Spray on bunk bed railings, on the floor, and mop using the supplied Swiffer wet jet or wet mop. Sweep the floor of any excess trash or dirt after the floor has been disinfected, and disposed of used cleaning materials in the outside trash can. If you run low on cabin cleaning materials, contact a camp administrator for a resupply. For pickup day, when we arrive home on Friday, we'll try to have a specific pickup time frame based on our number of campers in order to reduce density and physical interaction of individuals at any given time in the checkout area. Please encourage parents and guardians to stay close to or inside their vehicles until given further instructions, and try to maintain physical distancing with other parents and guardians and campers. Volunteers should also follow the handling luggage guidelines when assisting with luggage. Again, just a reminder that all campers, volunteers, and staff will be required to do a 14-day pre-camp health screening before departing for 4-H camp. I know this may seem like a lot, but we're going to make camp the best we can, and we're excited that we get to go this summer and very much appreciative of all of our volunteer leaders. We can't do camp without you. Thank you so much.